Good morning. I'm so glad that all of you could make our virtual meeting this morning on Zoom for the St. Louis Regional Chamber's COVID-19 briefing series with regional leadership. With the three largest counties in our region reopening, it's important to know how our governments are responding to ensure businesses open safely yet confidently. Before we begin, I'd like to take a moment to thank all of our healthcare and all workers who are on the front lines during our COVID-19 pandemic. I'm Tom Chulik, President and CEO of the St. Louis Regional Chamber, and today I'm very excited that we have three tremendous speakers who will discuss their respective governments' reopening plans and their ongoing COVID-19 relief efforts. Today we have St. Louis Mayor Lyda Krewson, St. Louis County Executive Sam Page, and St. Charles County Executive Steve Ehlmann, and they all remain committed to coordinating a regional response to this pandemic. I would like to thank them all for their leadership, their support of the region, and for taking time to address the business community by this virtual meeting this morning. Now I will pass the baton to Austin Walker, Vice President, Public Policy, St. Louis Regional Chamber. Austin?
Thank you, Tom, and thank you to everybody participating on the call today. If you have a question you'd like answered by any of our speakers, please use that chat feature in Zoom, and we'll do our best to get to your questions. Closed captioning is also available for these briefings, so please feel free to use that as well. Before we get started, I'd like to thank the St. Louis Regional Chamber's 2020 public policy sponsors. Their contributions support all of our policy programming throughout the year. The Regional Chamber is also happy to support a number of priorities that passed the Missouri legislature last week, including HB 2046, the largest workforce package this session, Senate Bill 591, reforms to Missouri's legal climate, and a number of infrastructure improvements that'll make Missouri a more attractive place to do business. Now, I'd like to introduce St. Louis Mayor Lyda Krewson. Mayor Krewson was elected to office in April of 2017, and prior to the election, Mayor Krewson served as the city's 28th Ward Alderwoman. As mayor, Krewson has focused intently on public safety, mental health, and increasing workforce and economic development. I'd like to thank Mayor Krewson for participating in multiple COVID-19 briefings and for being here with us today. Please welcome the mayor of the resilient city of St. Louis, Lyda Krewson. Mayor, the floor is yours.
Thank you, Austin. That was great. I love the enthusiasm, the resilient city of St. Louis. So thanks to everybody for joining this morning and for letting me just say a few words with you. And I'm also happy to take questions if that's appropriate. But of course, yesterday, most of you know, we, both the city and the county, we cracked the door open a bit on reopening businesses. And I know many of you are probably very happy to see that. I certainly am. And when I say crack the door open, we just didn't swing it wide open. The business community came together with the CVC and with a number of industry people in order to put out some very, I think, very helpful guidelines, industry by industry, for reopening, including offices. The chamber was a very big part of that. Austin helped extensively. Thank you for that, Austin. And so yesterday was the first day that restaurants, retail, offices were allowed to reopen because the stay-at-home order was lifted. There are still some venues which are not open, particularly large venues, gyms, summer day camps. Those are all things that we're working on now to figure out what we do with the next steps. But I think we are all trying to figure out, how do we coexist with COVID? And the restrictions or the guidelines with regard to opening the businesses give a lot of good advice on that. They require social distancing, staying 6 feet apart. They require masks for employees working with the public in retail and in restaurants. They strongly recommend masks for customers or for all individuals. We know that social distancing and just staying apart from people is the best thing that we can do, and that's why we've had the stay-at-home order for a long time. But we also, as we go out and try to coexist with COVID, we need to take some additional steps: masks, hand washing, all of those things, which I'm sure you've all heard of more than you'd like. So that's where we are right now, trying to see what happens here and hope that people go slow and are cautious, because COVID still exists in our community. We know that. But we also know that we have to get back to work. So that's what happened yesterday. We're expecting more guidelines to come out on large venues, maybe later on this week. And we'll be watching the numbers, watching the metrics. I mean, there's a couple of really key ones. Number of people who are admitted to the hospital is probably the most key metric. So we're watching that very closely. We're also watching the number of new cases. We expect we will get more new cases because we're doing a lot more testing. So we're identifying the people that are out there and positive who heretofore would not have been tested and therefore wouldn't have been counted among the case numbers. The city received the 20,000 tests last week. They have all been dispersed to the federally qualified health centers. We have many more tests on order, hundreds of thousands, but like everyone across the country, these pushed back. So we do have enough tests at this point to test everyone who is symptomatic. Between our efforts, the efforts of the hospitals and federally qualified health centers, but we know that having even more tests and then being able to, when we find a positive case, being able to trace the contacts of that person, to get them to quarantine, stay home, watch them, so that that one contact, that one positive case rather, does not create a lot more positive cases. So that's really the update for today. I know you have hearing from a lot of other people. And so I'll stop there, and Austin, take questions or whatever you like.
Mayor, thank you very much. And we also at the Chamber appreciate the collaboration with your office on our business-led working groups in coordination with Explore St. Louis. In particular, we definitely should give a shout out to Otis Williams, Linda Martinez, Austin Corns, especially Dr. Oles, who's done a fantastic job vetting everything that we've been doing. So please pass that along to your team. So as you mentioned, the city's partially reopened for over 24 hours now. What have you been hearing from citizens and business owners? I mean, what are the biggest concerns? Anything that you've been hearing so far?
You know, I think like everything in this, it's a mixed bag. Some businesses are not opening. Just because you can reopen doesn't mean you have to reopen. So some are kind of watching and being a little more cautious, and maybe you'll open at the end of the week. I've talked to some who have said that. So, and customers likewise. Now, bearing in mind, yesterday was Monday. It's not a big day maybe for shopping or going to restaurants. And it was a rainy day. So I think everybody is feeling their way, both consumers, customers, and businesses, because everybody wants us all to stay safe. Nobody wants to get sick, and they don't want anyone else to get sick. I mean, in addition, we're seeing offices reopen that had not been there before, but we're also seeing a lot of offices are continuing their work from home policies. And so I think that, you know, we're all trying to figure out what our office is going to look like in the future. And I have some ideas, but I certainly don't know the firm answer on that.
Sure. And as you know, the Regional Chamber's office is in downtown St. Louis City, and we're trying to figure everything out as well. And we're just going through the same phases as everybody. Now, you've been vocal about not receiving your fair share from the state in regard to COVID-19 federal funding. Can you explain that situation?
So when Congress passed the CARES Act 1, they said that cities or counties over 500,000 population would get money directly from the federal government. So in Missouri, that's only 2 counties, St. Louis and Jackson County. They each received $174 per person on a per capita basis. The rest of the money, which was $2.4 billion, went to the state, and they decided not to distribute the full 45% that had been called for in the CARES Act to local governments, but rather used a 25% number. So the city of St. Louis got $116 per capita, while St. Louis County got $174. So they got about 50% more than the city did. It's not just the city, it's every other county. government. We're hoping that Governor Parson and his administration will fix that for us in the not too distant future.
If you don't mind, we got a couple questions coming in from the chat. One, if things go well, how soon can the city be ready to move on to the next phase of reopening?
Well, I think the next phase is large venues. And we're looking at a couple, 2 to 3 weeks at least on that, because we do need to watch these numbers every day. And then when large venues, and when I say large venues, I mean meeting rooms, ballrooms, the zoo, the cultural institutions, the banquet centers, all of those places where you have a large number of people. And they will be, their capacity will be significantly reduced because of social distancing and because we don't want a whole lot of people mingling and mixing with one another. But we're hoping that we're able to do that in about 3 weeks. But honestly, we need to look at least a week's worth of numbers maybe before we decide that for sure. We want to get them open almost as much as they want to open.
Sure. Yeah. And in this next question, we've been getting a lot of questions about this. And spoiler alert to county executives that will follow you, this question will go to them too. Gyms and fitness centers. Is there a plan to reopen those? People really seem to want to get into those facilities and use them. Right.
So County Executive Page and I have talked about that a couple of times, and County Executive is meeting with some gym owners and operators. I know we're also talking to some gym owners and operators. We have to figure that out. Gyms are a bit of a special circumstance because of the number of people that are in there breathing hard and sweating, and you've got lots of equipment, and all gyms are not alike, of course. So we're trying to figure that out. We know people want to get back to the gym. I read something yesterday that I thought was interesting, that bike sales are way up because as people aren't able to go to their gyms, they're looking for other ways to exercise. At least that's the speculation. We're looking for other transportation modes. But so, our parks in the city of St. Louis have been open the entire time. And so there are other ways to exercise other than going to the gym. But we just want gym employees as well as gym customers to be able to be confident that they're going to be safe when they go to gyms.
You mentioned those parks. Those are a great option. I actually saw a picture, and I believe it was Twitter, of Tower Grove Park shut down. There weren't any cars going through, and the lanes were open for folks to just walk, and it was beautiful. With people returning to work, there does seem to come an elevated risk that we experience a resurgence. Now, if that happens, are you prepared to shut things back down, or what might that look like compared to last time? Well,
I think we all expect that with people going out more, returning to work, that we will see an uptick in cases. But we're going to watch that, cases and hospitalizations, going to watch that very closely. We will work with the Pandemic Task Force, which I should have mentioned them earlier. We've been working with them all along, and that's Dr. Garza, who you all may see on TV or social media. He's the incident commander for the St. Louis Metropolitan Pandemic Task Force. It's also Dr. Clay Dunnigan and Dr. Steve Lawrence, a number of people. We're all working together to figure out what the metrics are. Nobody wants to go back to a hard stay-at-home order. We're going to try to be very thoughtful about that, but I don't rule that out as a possibility. We're going to be watching where the cases come from. Are they coming from a particular location, either geographically or a particular business or nursing home? We're going to be watching that, trying to intervene in helping all of those folks. We don't want to go back to a hard stay-at-home order, but it's not an impossibility.
This is the last question. Are you considering banning customers from entering establishments if they're unmasked?
So I'm not. I am strongly recommending that folks wear masks. I don't know how many of you are on social media, but if you're on my social media, you can see we've done a lot of talking about wearing masks, even putting out a little video yesterday that had John Goodman in it and Allison Mace, who is with Sauce Magazine, and some city employees. So check that out if you are on Twitter or Facebook. So we're very much encouraging mask wearing. I get a lot of questions about this on my Facebook Lives that I do 3 times a week. And what I say is, one, if you're comfortable, offer someone a mask, carry a few masks with you. If you're not, just steer clear of them, because folks who don't wear a mask are probably at much greater risk of getting COVID than those who are wearing masks. Part of the reason I'm not considering making it mandatory is I don't want to put businesses in that position. We know that some states have done this. We know Illinois has a mandatory mask, but we also know that then the folks who work in grocery stores or hardware stores, wherever, they have to post an employee outside the business, and that employee has to take a lot of flack from customers who don't want to wear masks. Some employees have been spat on, some employees have been cussed out, employees, even a knife pulled on one of them that I heard. It's become such a hot issue, I guess. I don't want to put businesses in that position necessarily. Businesses can do it if they want, but unless we're prepared to do a lot more law enforcement support, I'm not prepared to mandate it.
Well, Mayor, thank you very much. We really appreciate that. That's a fantastic update. And again, thank you to you and your staff for everything that you're doing for our businesses in the city. We appreciate you being with us today.
Thank you. Appreciate the chance to talk with all of you. Let me know if I can help you with anything.
Absolutely. Thank you, Mayor.
Thank you.
Now joining us is the St. Louis County Executive, Sam Page. Dr. Page was elected St. Louis County Executive in April of 2019. And prior to serving as county executive, Dr. Page served in the Missouri House of Representatives as its chairman of the county council. I would like to thank Dr. Page for joining us for an earlier briefing in March and for being here today. Please welcome County Executive Sam Page. County Executive, the floor is yours, sir.
Thank you, and good morning. Yesterday in St. Louis County, we began a cautious and gradual process of reopening with business guidelines that were developed with our business leaders, with our public health officials, and in conjunction with the city of St. Louis. And we've had a lot of questions regarding those guidelines, and we've been giving that feedback pretty much continuously for the past week. My observations and reports yesterday, it appears that our business community, our businesses have been prepared, and they have instituted these guidelines, and they're taking this very seriously. And we are, again, strongly encouraging everyone to wear masks when they travel about, to follow these social distancing guidelines, and recognize that our progress moving forward depends entirely on the acceptance of these social distancing guidelines in our community from our businesses, but also from our public. We continue to address this as 3 crises. It is a public health crisis, a humanitarian crisis, and an economic crisis. And we will coordinate a response regionally in all of those regards with our surrounding jurisdictions. We will continue to look at next steps. As the mayor said, large venues, we're in discussion about those guidelines now, and we hope to continue to develop a timeline and business guidelines in conjunction with the city of St. Louis. And we've had great cooperation in that regard, and expect that to continue. We're working on summer camp guidelines as well. We expect our day camps to be open this summer, but we want to make sure they can do so safely. And of course, some of their functions will be limited based on risk of COVID-19 transmission. And we're looking at other venues where in the county we see a likelihood or possibility based on our public health guidance and our experts of higher transmission of COVID-19, predominantly around gym and workout facilities. And we'll be meeting with some representatives this week to try and devise those guidelines. But we're seeing here in our community, what we see across the country, that these venues are considered to be higher risk, and we want to make sure that when they open, that it's safe for their employees and their customers. We'll continue to communicate with others in our community who have concerns, have questions, are looking for guidance, and that guidance is available on our website, stlcorona.com. You can track county statistics, business guidelines, and I would encourage folks who not only if you own a business, I think you can get your questions answered then, or follow up with us for more specific guidance, but also individuals who are going about the community and want to know what to expect as they go into a restaurant or retail location. They can read those guidelines too, and they can have the same guidance that our business leaders are turning to. We believe we've met the milestones for a gradual and partial reopening as hospital capacity is dropped, and this is measured predominantly by hospital admissions. We believe that's the best number to watch at this point. And also we're increasing our testing capacity in St. Louis County. We have tests provided through many resources, not just the County Department of Health, but also our federally qualified health centers. Our hospital systems are providing testing throughout the region, urgent care centers, and then also private labs. And we'll continue to coordinate that testing to watch the results of positives and negatives and follow that trend as well. There are many, many individuals involved in testing. We do believe now we're at the point where if you have symptoms, you can get tested, no longer limiting those to individuals who are high risk with symptoms, but anyone with symptoms. And then we are beginning asymptomatic testing in areas of a high prevalence of COVID-19 and also high risk environments such as nursing homes and congregant living facilities. And I would be glad to answer any questions.
County Executive, thank you very much. And I also want to thank you for your collaboration on our BIS-led working groups focused on reopening and working with your staff, in particular Winston Calvert, Core Faith Walker, Spring Schmidt. Really appreciate all of the help from the county. Mr. County Executive, the same question goes to you as went to the mayor. So the county's been reopened for 24 hours. What have you been hearing from regular citizens, business owners about their biggest concerns? Anything interesting to report from yesterday?
Well, I think the first to report is that there's been wide acceptance from the businesses who are ready to open. There's been wide acceptance of our guidelines. We've had a lot of follow-up questions, and we have many people in our public health department that are answering those questions. We've had some concerns from employees who aren't ready to go back to work, and we've encouraged them to have conversations with their employers about duties and assignments and making sure that our guidelines are being followed. There's some questions about unemployment, and we've referred to them to the state as employers and employees have to make a decision about coming back to work with a situation where the volume might be limited at this point and everyone might not be needed. So at some point, some folks may continue to draw unemployment benefits. And of course, there is a subset of folks out there who don't believe we should have reopened, and we hear from them as well and respect their opinion, and we'll listen to their concerns too. But we believe we have the right pathway forward. We've met our milestones of reopening, and we are headed in the right direction.
So on that, so with the history of festival and neighborhood types of large events, when do you see those as safe to return, like the Clayton Art Fair, concerts in the park?
Oh, we're all very excited to get back to ability to gather and socialize in large groups, but we also recognize that this is the highest risk activity for COVID-19. And we have to be very cautious about watching our numbers, the hospital admissions, and the testing results. And really, it's impossible at this point with the information we have today to make a prediction on a date. We'd like to see we'd like to see more gatherings in June. And I think you'll see already how large employers, a lot of churches are reacting to this information. Most are waiting until mid-June. If you can work from home, many will continue to do that. Most other folks who gather will continue to wait because we just don't know where we're going to be. And it all depends really on the acceptance of social distancing. Can people get used to wearing masks in public universally? when they can't be 6 feet away from someone else when they're out and about? Can they accept the social distancing guidelines that will be in place? And if so, then I think we can continue this conversation of a next step. But we know large crowds are high risk, and as we watch the testing numbers and the hospital admission numbers over the next couple of weeks, we'll be able to make that decision.
Yeah, certainly are risky. And, you know, on that, and it's probably around the same answer, but we've been getting a whole lot of questions from the county about pools reopening. As kids are home for the summer, you know, that's a thing here. So any thoughts there, any special considerations?
Well, I think everything surrounding COVID-19 has turned the world upside down, and it's extraordinarily frustrating. And pools is a really a great example. But we're looking at our public health guidance from the CDC and from here locally, and we just don't have good information on what does chlorine do to this particular virus, and what does a congregation or gatherings around pools do for risk. And it's really a big question mark from our public health officials nationally and regionally as to what that risk is. It seems rational that chlorine would kill just about anything and would kill this virus, but we're just not there yet in guidance. And without that guidance, it's just not reasonable to say, well, let's go try it and see what happens. So we're continuing this conversation. It's something that we're all watching very closely, but I think it'll be a bit before we have an answer on pools.
Sure. You've been vocal about using data to determine reopening measures, as you've been talking about, and you also mentioned testing. And we keep hearing that testing is the key to move our region forward. And you also mentioned who would be able to kind of get one. How's your office ensuring that those who need a test receive a test? And maybe what are some of the hoops that you're having to jump through to give those out?
Well, we're competing nationally to procure these tests. This is a national shortage that everyone's aware of. And we're competing as well. In St. Louis County, most of the testing is provided in the private sector hospital systems. The St. Louis County Department of Public Health does some testing as well, and so do federally qualified health centers and urgent care centers. So there are a whole lot of folks providing testing in St. Louis County, and our main response from our public health is to coordinate those results, give guidance to make sure that they have the resources they need to supplement those resources whenever possible, and to communicate with the state with our needs because they're supplementing what we're able to purchase as well. But we'll continue to purchase as many tests as possible, move them about the community through public health and to our regional partners. As far as data goes, yes, our decisions will be data driven, but unfortunately that data comes in on a daily basis and we have to react to those trends, not just that day, but those 7-day averages. And until that data arrives, it's really impossible to predict. We can use models, and models are helpful. And we believe models provide us some guidance, but you know, we get the data in on a daily basis, and that drives our questions and our decisions.
Sure. Now, County Executive, we've been hearing a lot of questions about what this information really means. We've been putting out information on businesses reopening, and from the county standpoint, can you clarify, are these guidelines or enforceable laws?
What do you mean, guidelines on who can open?
Yes.
Or business? Well, the business guidelines, what we've seen from the vast majority of business owners, responsible business owners, are that they just want to know what the right thing to do is. And I think that's a representative of our community. There are some folks who see confrontation as, you know, that's their personality. We understand that. There's some folks that don't necessarily accept local, state, or federal government rules, regulations, or laws. But the vast majority of folks in our community want to know what's safe. They want to know what's right. They want to know how to do it right. They want to keep their employees safe, and they want to keep their customers safe. And those who want to do that will follow our guidelines because they're driven by data. They're driven and created through public health experts with guidance from the CDC. And that's a safe way to do it. And that's my responsibility as county executive, is to look out for the health and welfare of everyone in our county. And that's why our guidelines are there. I believe that enforcement of these business guidelines will be in a large part by the customers. If we see large outliers, then I'm sure our public health department will come in and give guidance. And if folks don't respond to that, which I think would rare, then there's other interventions we can take. But the vast majority of folks are going to do the right thing. And if customers see places that aren't safe, they'll talk about it, and those places won't get much traffic. As far as our stay-at-home orders go, you know, they are enforceable. They've been challenged throughout the country and here regionally, and we'll look at that on a case-by-case basis. But I've just been encouraged at how our community has reacted responsibly. Our businesses have reacted responsibly in this reopening, with few exceptions. And you know, our citizens are reacting to social distancing, and that's allowed us to get to where we are today from a rapid and worrisome escalation of cases, reaching to the point where our hospitals could have been overwhelmed. But these social distancing guidelines have allowed us to turn that around and to get us where we are today to be talking about a gradual reopening.
I think that we'd have to agree about the businesses and the fact that, you know, you got a lot of businesses wanting to do the right thing. They want to protect their customers in the community. So thank you for that. And last question, County Executive, with people returning to work, as I asked the mayor, there does come an elevated risk of resurgence. And if that happens, are you prepared to shut things back down? And what might that look like?
Well, we'll do what's safe. We'll follow the recommendations of our public health officials, doctors, scientists, our pandemic task force, and we'll do what's safe to protect individuals in the county. Sure, if this trend goes in the wrong direction, and we believe that it's not a trend we can control otherwise, beyond closing things back down or taking a step back to a partial closure, then that's something we would consider. We're hoping we don't have to do that. We're hoping that with wide acceptance of social distancing, wide acceptance of our business guidelines to protect their employees and customers, that we will be able to continue on this trend of gradually reopening.
Well, County Executive, I want to thank you and your team. Really appreciate all that you've been doing for the region. You've been laser focused on this issue, and we really appreciate everything that you're doing.
Thank you. Thanks
for being here. Appreciate it. And now joining us is the St. Charles County Executive, Steve Ehlmann. Currently in his third term, Steve Ehlmann has served as County Executive since 2007. Throughout his career, County Executive Ehlmann has been a member of the Missouri House of Representatives and served 2 terms as the Senate Republican floor leader. I'd like to thank County Executive Ehlmann for also joining us for a previous briefing in March and for being with us here today. Please welcome County Executive Steve Ehlmann. The floor is yours, sir.
Austin, it's great to be with you. Just a little report on what's been going on in St. Charles County. The good news is, as you know, we are about 2 weeks ahead of St. Louis City and County in terms of opening up. We made the decision 2 weeks ago to basically follow the governor's order, and I'm happy to report that in making that decision, we first of all listened to the medical experts and looked at the statistics. And at that point, we had a 14-day period in which we had a decline in the number of positive cases. I'm happy to report we're now on our 36th consecutive day of decline. So that has continued, and we have not yet seen any sort of uptick as a result of opening 2 weeks ago. We certainly hope and pray that trend continues. When we made that decision, after listening to the experts and looking at the statistics, we also listened to the public. And you know, there's a certain libertarian impulse in St. Charles County. There were a lot of people that were not happy about being told that they had to stay home or had to do anything. And that impulse was rather strong. I would say stronger out here maybe than in St. Louis County and St. Louis City. But at the same time, I predicted when we made the decision that when we did allow people to make the decision themselves, that the reaction would be that of a rather conservative public, and that's what we've seen. Given the choice, not everybody immediately went out and ate at a restaurant or showed up at their neighborhood bar or even went back to church. And the response has been slow and gradual, and more restaurants open all the time. But people generally have been very, very cautious, and I think very responsible in how they have reacted. Given that, I will offer as a bit of advice to my colleagues who are, again, going to experience this for the first time. The biggest problem that we've had out here has not been with retailers or with restaurants, but it was with bars. And basically, I would say that alcohol, young people, and corona and social distancing don't mix. That's been our biggest challenge. We've worked hard to try to improve the situation, and it is a lot better than it was the first Friday night. But we still have a real challenge getting young people when they go into a bar to understand that the governor's order requires them to stay 6 feet apart. And if there's one thing that one bit of advice I would give people is that's one of the areas that's going to be the most challenging. The other area that we are very concerned about as we move on to phase 2 here is what's going to happen with the casinos. We have a situation where we know the Gaming Commission has announced that casinos will be allowed to open on June 1st. Under our existing orders here, there's nothing to keep them from opening in St. Charles. And of course, we have a very popular boat out here that normally competes against equally popular boats in St. Louis County, St. Louis City, and Illinois. If the county and city of St. Louis do not allow their boats to open and Illinois remains the way it is right now, we will have every gamer in the entire St. Louis region at the St. Charles boat on June the 1st. And normally we would welcome that for the revenue it would bring to the county or to the city in the county. But in this case, they're not only going to bring their dollars, but they're going to bring the virus with them. And the really interesting thing about that is that my experience, and I don't go there to gamble, but I go to the casino occasionally for social events, and what I see there is a lot of people my age who are 65 and older, some of whom probably have other medical conditions, and that's the group that is most at risk. And yet that's the group that's going to be coming potentially to the St. Charles Casino if it's the only one that opens on June the 1st. So I'm very hopeful that that the city and the county and maybe even Illinois would relax some of their restrictions so that if we're going to have gaming, that we do not have everyone coming to St. Charles County on June the 1st. So the other point that I would make, I think is important now, is as we relax these stay-at-home restrictions, we need to do an even better job at our contact tracing and the quarantining that needs to be done of those people who are actually infected. It was real easy for all of us to issue orders and just tell everybody to stay home. And it's a little easier to enforce that. You just, anybody who's not home, you suspect may be in violation of the order. But the more important thing now, and even back then, was what about those people who are actually infected? What are we doing to make sure that they stay at home? And equally important, the people that the infected person has had direct contact with, have they been properly informed that they're at risk? Have they been advised that they need to quarantine as well? So we're allowing greater freedom for everybody, but we need to really make sure we're doing a job, doing everything we can to make sure that when you go to that restaurant in St. Charles County or now in St. Louis City or St. Louis County, when you go there, you can be assured that the jurisdictions there have done everything in their power to make sure the person sitting behind you in the restaurant isn't actually infected with the disease. And I just think as we relax the stay at home, we really need to be working harder and harder to make sure that we're quarantining those who are infected and very likely to pass the virus on to someone else. So I'll go ahead and stop there. I'm sure you have questions for me.
County Executive, thank you for that, and really appreciate you joining our members today. So you mentioned bars being a particular problem there, but that the issue has improved a bit. Is there anything that you guys did in particular to help that?
Well, the first report that we had that there was a problem, I sent a letter the next day to every bar or restaurant in St. Charles County that had a liquor license, just explained to them pretty much what I've said to you, that it's important that you understand exactly what's required, that you constantly remind your customers that they need to do these things, because the governor's order doesn't allow us to punish the person who does not social distance. It simply requires the businesses to enforce that. So that's the first thing we did. Last Friday night, we were actually in some of the establishments in the county that we felt were not doing a very good job, and worked with them trying to get the people there to do the proper social distancing and make sure that they did not let too many people into the establishment. And again, we saw a great improvement the next night, but I'm sure people are going to have to continue to be reminded that this is absolutely essential that they do these things. And of course, you've got young people often are the people that are not doing these things, and they think they just forget that they're vulnerable as well as the older folks like myself.
Sure. And so let's address the other population on the other end there. So how does St. Charles County addressing nursing homes, assisted living facilities? We've been getting a number of questions about that.
Yeah, we're trying to go ahead and get permission, to do testing for people in nursing homes who do not yet show the symptoms of the disease. 75%, there's been 50 deaths in St. Charles County, and 75% of them have been in nursing homes. Almost 80% have been people over 60 years of age. So this has had a real impact on the elderly, especially if they have prior existing conditions. And see, that's one of the interesting things here. We've had all this discussion about stay-at-home orders, and again, in St. Charles County, 75% of those who have died were staying at home. They were staying at nursing homes, and they were not allowed to leave those nursing homes. And yet, they've had a tremendous number of deaths resulting. So, you asked Dr. Page, what if we have to reestablish some of these restrictions, and God forbid that we do, but if we do, I think we need to be smarter about focusing on who's most at risk. And that's why the casino issue to me is so important. Instead of requiring, these millennials to do certain things, maybe we need to really concentrate on those groups who are most at risk and provide them the most assistance and encourage them to be the most cautious.
So now you mentioned the resurgence question there to Dr. Page. And it's, as you know, and I think folks know on the call, the politics out there in St. Charles County are always interesting. And you mentioned that libertarian impulse in St. Charles. So one, do you think that's unique to the region? And two, if there is a resurgence of outbreak, do you think that same libertarian impulse will make it harder to shut things down again if necessary?
Well, I think it will require us to do what I've just said, and that is explain better why it's necessary and why the new approach is going to be more effective than the last approach. And I mean, I don't think that's unique to St. Charles County. I think you're seeing it throughout the country. I keep looking for stories about Georgia. Don't really see too many yet. You know, they started opening up 3 weeks ago, and there were all sorts of predictions of a terrible outcome, and I certainly hope they're wrong. But I haven't heard of that happening there yet. You know, Judge Brandeis talked about the 50 states being the laboratories of democracy. Well, within each of those 50 states, we have hundreds of political subdivisions, and everybody's doing this a little bit differently than their neighbor. Hopefully, we'll find, by looking at all those various examples, hopefully we can find one that works the best, and it will be adopted by a lot of other people. We're constantly looking at what our neighbors are doing. We're constantly looking at ways that we might be able to really focus in on those who need the protection the most and provide it to them. So anyway, we'll wait and see how that happens.
We've been getting a number of questions about testing and how widespread testing might be in St. Charles County. Is any notion of that per capita?
Well, we don't think it's as extensive as in some of our neighboring counties. We think about 6,700 people have been tested in St. Charles County. I read in the paper the other day where Dr. Page thinks it's around 20,000 in St. Louis County. Of course, we only have 40% as many people as St. Louis County. That's one of the interesting things here. You know, as we get more testing, we may see more positives, and people need to understand that would be the result of more testing, not the result of loosening these restrictions on stay-at-home orders.
Sure. Now, you mentioned you're about 2 weeks ahead of St. Louis City, St. Louis County. Do you see pools reopening this summer in St. Charles, gyms and fitness centers?
Yes, I see. Definitely fitness centers are allowed to open now. I started going back to the one that I go to, and it's an entirely different regiment that I see there. They no longer do the large groups of people, exercising together. They have everybody spread out. Every instructor has the squirt bottle and a towel and wipes off the machinery after it's been used. So they have adjusted, and again, they need to do those things in order to reassure their customers, because if their customers don't feel comfortable being there, they're going to end up having to close again. So again, we need to put some trust in the businesses here. It's in their self-interest to do these things, and it's up to the customers to require businesses to do the things that ought to be done. And if they're not doing them, then they need to find somewhere else to eat or to shop or to exercise.
So this next question comes from our friends at the United Way. What are the funding priorities for the $47 million CARE Act dollars St. Charles County has received?
Well, the funding priorities, first of all, is to deal with the political subdivisions here in the county that have suffered financial loss. We've received requests from the cities and from various other political subdivisions, the ambulance districts, and so forth. PPE is obviously something that they all need, and that's really one of our high priorities. And we actually are in the process of discussing this with our council. We presented a bill a week ago in which we took the $47 million, which we've been allotted, and at least made an initial suggestion to them as to how much should go to different causes. And we're in the process now of discussing that with them. We will have our next meeting a week from Wednesday. They will vote on how that money will be divided up. But we've suggested to them from the beginning that that's just an initial recommendation based on the facts at the time. And as you know, the facts seem to be changing constantly. And we will have to adjust as we go forward here. And if certain areas develop where we have a greater need, we will adjust that funding and adjust our priorities.
So County Executive, last question. You mentioned bars being kind of something that the city and county should be looking for. Is there anything else St. Louis City and County can learn from St. Charles? Anything that you would do differently?
Anything that we would do differently? Well, we would probably work harder to convince the governor that we need more than $116 per person, given the fact that Jackson County and St. Louis County get $174 per person. We're very happy for Dr. Page and the fact that he has that money, but I know that the mayor and I both would love to have the same amount, and frankly, we don't see that big a difference between the jurisdictions on that issue. And we had a conference call with the governor this morning, and we're continuing to encourage him to release more of that money, not to every county on the basis of population, but to the counties and the city of St. Louis who have been most impacted. We think that money should be distributed on the basis of need, not simply on the basis of population.
Well, County Executive, thank you very much for participating today. And I want to thank all of the officials for joining us today. And thank you for all of you for joining our COVID-19 briefing with regional leadership. And I'm happy to see that our region's elected officials continue to collaborate and engage with the business community. Our region is resilient. Our region and our nation begin to reopen. The St. Louis Regional Chamber remains committed to serving as a resource, convener, and advocate for our members, investors, and community partners during our recovery. Please join us for a special speaker series tomorrow at 10 a.m. where we'll have a number of Missouri legislators give a recap of the 2020 legislative session, what has passed and what's to come. In addition, there'll be another business sustainability and recovery series on leveraging technology to accelerate healthcare innovation. Our panel of experts will share how technological changes are revolutionizing the healthcare system. And that Zoom meeting will be held on Thursday, the 21st at 10 a.m. So please see our website for more details. Again, thank you for joining our virtual meeting today. This meeting is adjourned. Have a great day.